From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky, and those of you as far west as Jackson, Tennessee, and out there out east down McMinnville. This is your host, Dr. Sean Pruitt, and welcome to another episode of Pharmacist on Call. And if you're watching this show, I am your community pharmacist. Everyone, welcome to another show. This is your 1 hour forum to get all those questions that you've had from your doctors and your pharmacists, but they haven't been able to answer them because, frankly, they don't have time. But guess what? For this hour, I do. So call in with those questions and those comments. The producer is going to flash the information on the screen here, the phone number, 737+. Give us a call and ask us about whatever questions that you happen to have. I did want to get into, we do our shout outs and our condolences as we normally do. So I wanted to wish the family of William Council, I wanted to extend our condolences to them. I just saw his daughter yesterday, and I hadn't seen Mr. Council in a couple of years. So he had passed maybe around that time or so. So probably the toughest person that we had as a patient. That was a pretty tough old guy. So sorry to see him go, and again, condolences to his children. I believe his wife passed shortly after him, so certainly want to extend condolences on behalf of them for the passing of their parents. Also wanted to extend some congratulations, my niece Chelsea Sinclair Thomas, on the birth of her son Carter James Thomas. So I think he just turned a month old. So my great nephew Carter C. Jizzle, yes, we'll try to catch up with you a little later. Also Tayana, also her best friend, wanted to wish her a congratulations on her birth, on her baby's birth too, and I'm not sure what she named her daughter, but I'm sure I'll hear about it after the show here. But again, this is your 1 hour forum. We're waiting on these calls to come in, and if they haven't come in, we're going to get into some supplements because I know that's what you all like to talk about. So the first one that I wanted to discuss, and it's probably the second mover as far as what we sell, and this is our organic beetroot juice. And what this does, this is our solution for blood pressure, our solution for diabetes, our solution for those of you who are dealing with anemia, those of you who are dealing with liver issues, those of you who are dealing with pancreas issues, kidney issues, a bevy, a sundry of health conditions. Beetroot juice treats it. So this became pretty popular. I was open about a year, and a number of the truck drivers could not pass their test, but it looks like we got our first caller coming in. So we're gonna get to them, and then we'll get right back into these supplements, okay? Welcome to Pharmacist on Call. I mean, we help you.
Yes, I have macular degeneration, and is there any supplements that would help improve the condition?
Macular degeneration, I would guess lutein and maybe the CBD oil or hemp oil. Okay. Yeah.
And then how do you use the hemp oil? I mean, is it
the hemp oil? What we have now are sublingual drops. What you'll do is you'll start out with, it doesn't have to be your final dose, with about 5 to 10 drops under your tongue. You'll leave it there for 1 minute. In that 1 minute, it's going to cross the thin membrane of skin under your tongue into the bloodstream, and then it gets into your bloodstream relatively quickly. So you do that once a day or so.
Okay, so the lutein and hemp oil would be the two.
Yes, ma'am. Those would. Absolutely, yeah. Those would be my two guesses. How often are you seeing your doctor about it?
I had been going about every 9 weeks, but then my left eye started getting a little bit worse again, so I'm going now every 7 weeks.
Are you on any eye drops right now?
No, I'm just using drops for dry eyes because my eyes are always, pretty dry.
Okay. Okay. Yeah. Yeah, try that hemp oil.
Okay, well, thank you so much, and you have a great evening.
Yes, ma'am. You too. You know what? I started into the supplements, and I haven't even explained who I am or why I'm here. So let me start there. My name is Dr. Sean Pruitt. I own Pruitt's Discount Pharmacy in Nashville, Tennessee. I also own Pruitt's Pharmacy at Napier Clinic. I also own the Kangen Water Store of Nashville. And so we began August 4, 2012 on a mission to help those people who were having to pay high prices for their medication. So we're Middle Tennessee's only discount pharmacy, and that's what we did. We lowered our prices to take care of people, to make sure that they could afford the medication that they needed. And that came from a study done by the Tennessee Safety Net Consortium that found that there were 100,000 plus Middle Tennesseans who did not have insurance. And so these were people who did not have the luxury of paying a copay when they got their prescriptions. You were going to have to pay the full cost. And if you couldn't afford it, then you were probably going to have to sacrifice something else, whether it's utilities, food, or some other amenity of life. So what we're going to do is increase outcomes, increase people's recovery from the issues by making the medication affordable. It doesn't do you any good if a prescription is written and you can't get it. You know, so that was our mission, to make it more affordable. Looks like we got another call here, so we'll get back into that. James, welcome to Pharmacist on Call. How may we help you?
Hello?
Yes, sir. Welcome to Pharmacist on Call. How may we help you?
Yeah, my wife, about 4 weeks ago, she started losing some of her memory. She's been having trouble with her bowels. She don't know when she's got to go to the bathroom, the number 2.
Okay.
And I've tried to get her to go to the hospital, but she throws such a fit. And reckon what I can do for her to...
So what medication is she on?
Really, the only medication she's taking right now is her insulin for diabetes.
How's her sugar running?
It's been running high.
Okay. Then that may be the source of our problem. I think we need to get that sugar down. How is she running when you check her blood sugar?
It's been running 4 something, and then maybe down 3 something.
Yeah, so it sounds like it's her sugar affecting her mental state. So you're probably going to have to get her to the emergency room, honestly, to get her sugar stabilized.
I've had her up there twice in the parking lot, and she's scared that she don't want to stay, and she'll get to throwing a fit, and I've been afraid that she might give herself a heart attack or something and get so mad about it, so I just bring her back home.
Okay, I understand, but yeah, she's got to get medical attention, because she's not able to keep it down at home by herself, and actually her throwing a fit is going to send the sugar up anyway.
Yeah, that's
so it was probably even higher than before you brought her to the ER. But just
I didn't know if it'd make her so much more upset if I tried to force her in.
Yeah, I think we're going to have to do that, you know. So I think you'd rather her be here and pissed off than, you know, the alternative.
Yeah, you're right.
Yeah, so let's explain to her how serious this is, and that the way she feels the way she does is because her sugar is too high. And, you know, they're just going to get her stabilized, and then they probably need to just go up on some of her medicine at home. Is she keeping doctor appointments?
No, she hasn't.
Okay. So, yeah, and that's the other problem, too, because some of her medicine may need to be adjusted, and that's probably why she's cheating on her diet, too?
No, not really.
Okay. And then the other thing is, sounds like we got some dehydration going on, too. Is she much of a water drinker?
She stays thirsty and drinks a lot, but she just stays thirsty all the time.
Yeah, so that lets me know, yeah, the sugar is way out of control, and she's probably complaining about numbness and tingling all the time.
Yeah.
So tell her, you know, just go ahead, and even if it's for a day, which I don't think it would take that long to get her sugar stabilized, but just tell her, look, the TV pharmacist said the best thing for her to do is to go ahead and go to the ER and get it taken care of.
Okay.
And then have her call me if she's got an issue and she just needs to talk to somebody about it before she goes. The producer's going to flash my store information so she can call me tomorrow.
All right.
Yeah, but tell her it's very important that she gets to the doctor.
Okay. And another question, I heard today that they're going to start, Blue Cross and Blue Shield's trying to get rid of the opium and going to start, I think, maybe prescribing the hemp oil.
Yeah.
Have you heard anything about that?
No, but I have heard that there is a prescription strength of cannabidiol about to come out, but I can see them, you know, and I see insurance companies, even TennCare now, reducing the amount of opiates that they cover, or just not covering them at all in smaller quantities. So, and I've had a number of doctors refer their patients to me for the hemp oil. So kudos to you doctors who've done your research and who listen to your patients, and now you see that it actually does help with getting off of pain medicine and still helps pain relief as well. So kudos to you doctors.
And I've tried the cheapest bottle you've got one time, and it seemed like it kind of helped at first, but then it seemed like it kind of died down.
Yeah, and did you adjust your drops? Because you have to keep going up till you find your comfortable dose.
I tried to go up on it some, but then I run out, and I hadn't got another bottle yet.
Yeah, how many drops did you use before you found that it helped you?
Well, first, I think about 7 or 8, and then I finally got up to about 15 time I run out.
You can still go higher than that.
Still go higher than that?
Yeah,
Okay.
there's some people that take one whole dropper full. I just tell people to start out with those drops because a little bit may be enough for you. Yeah, but that's just a starter dose.
All right, thank you.
Yes, sir, thank you. But have your wife call me at the store.
All right, appreciate it.
Yes, sir. All right, thank you. Yeah, so he raises an interesting point, people. So if you're not feeling well, so those of you who are diabetics or the loved ones of diabetics, if that sugar is getting really high, it's going to manifest in that mental confusion, that agitation that he mentioned. Is going to manifest in you going to the bathroom all of the time. It's going to manifest in thirst because you're dehydrated, because that sugar is following that water's following that sugar, and it's dehydrating you, and so you're trying to sip to keep up with that dehydration. You're also going to notice some numbness and tingling. So that's how you know your blood sugar is going to be out of whack. But again, that mental confusion, a hallmark symptom. And certainly a blood sugar of 300-400 is really really high. And I'm sure he's taking it she's taking it fasting at 300-400 is pretty bad. So make sure if you're going through these symptoms, make sure you get some medical attention, or talk to your doctor about adjusting your dosages, or this right here, help bring it down with some beetroot juice. But those are your symptoms for diabetes. Also wanted to, I guess, get back into the history of who we are and what we do. So again, I say we discounted medication for the uninsured. We kind of morphed into a natural care pharmacy. So I opened the Kangen Water Store of Nashville, which is Nashville's largest distributor of alkaline water. We do pretty well with that. And so you're saying, what is this alkaline water I keep hearing about? Well, it's water that we take through about 4 different processes. First, we remove the chlorine and the fluoride through a series of filtrations. We electrify the water over 7 titanium plates. And then fourth, we adjust the pH up or down depending on what issue you have. But I think we got another call here, so we're going to get into that one. Nancy, welcome to Pharmacist on Call. How may we help you?
Yes. How you doing?
I'm pretty good.
My name's Nancy Brown.
Yes, ma'am.
And I just tried the hemp drops.
Yes, ma'am.
But I have so much going on with the fibromyalgia, and the spondylitis, and severe chronic pain.
Yes, ma'am.
I was wondering, is there different doses for different problems? I know the one that I have, it says it's good for think nerve damage. I believe I have a pamphlet here.
Okay,
but,
what brand do you have?
Well, it just has the little drop, and it just has the hempa on it.
Okay, did you get that from us?
No, my daughter took me to one that was on the news station.
Oh, okay. Okay.
Yeah.
Let's see. So how many milligrams is in that bottle?
Well, it's hemp CBD oil. You say how many? What is it?
Milligrams. So to answer your question shortly,
Yes.
your dose is going to be individual. So yeah, you'll have a certain amount of drops may help your migraine. A little bit more may help the ankylosing spondylitis, and then a little bit more may help any other condition. So you may have to go up and increase your dose depending on what your needs are. You follow me?
Yes.
Yeah.
So it's not any different types of it for different.
But no. All of them are going to be, either pure CBD, a full spectrum, which has, a large number of the cannabinoids, and then there's some with THC. So the one that you have, it's just pure CBD. Okay, then yeah, you're just gonna have to keep going up on it. So today you start with 5, tomorrow 10, maybe 15, until you find that comfortable dose. And your dose may be different from mine. So the dose printed on that bottle is not gonna be standard for everybody. So that's what a lot of people think, that few drops is gonna help them. That's not the case. Our bodies are all different. And so my requirements may be more or less than yours. So you have to keep experimenting with the dosages until you find which one works for you.
Okay, and where are you located? I heard you tell it one time before.
Yeah, we're on Dickerson Road. We're about a mile or so from Titan Stadium. So we're in the Morant Plaza, 811 Dickerson Pike. So just continue to watch the show, and the producer will have our information flashed up there.
And I also wanted to say God bless you for being in 2012, giving everyone discounts on their medication. Because I'm sure you didn't foresee the 2018 crisis of insurance and prices of medication.
No, ma'am. I was not focused on 18. I was trying to help people in 2012. But thank you very much.
All righty. Thank you.
Yes, ma'am.
Bye-bye.
All righty. Bye-bye. Very nice call. All right, everyone, stay right there. We're up on our first break. We'll be right back. I see we've got the calls lining up.